Right, so we start. Optimizing bone health before you retire. Like most of us reaching our retirement age, unfortunately. And then we need to know like how much we have invested to maximize our health to spend the next years without much trouble. I'll talk you through some important areas on bone health, what we should be doing. Right. So, as a little introduction to the topic, we have heard like bankers would tell you like invest some money, have some plan, so that you can have some money after retirement. But we, being orthopods, we say invest in your bonds for better retirement. It's actually better than having money if you have good health during your retirement. And then we also look at like why bone health matters before and after retirement, because the weaker bone will bring you osteoporotic fractures, which make you to be disabled, dependent on someone else. Also, to the community and to the health system, gives a burden and a cost. So, main objectives of this talk today is to let you understand aging and you, and then identify MSK, that is musculoskeletal risk associated with aging, and then how to reprogram your lifestyle, and other medical strategies so that we can have optimum quality of bone after retirement, and then apply these principles to ourselves, of course, to our patients, and thereby delay bone decay. This is a simple set of pictures which will sort of illustrate what happened to your bone physiology with age. Usually, you achieve something called peak bone mass, that is the maximum amount of calcium you can deposit in the system by the age of 20 to 30. Suppose to say female achieve this before the males, and then we start losing after 20 years as a like a progressive loss to the axial skeletal bone mass. Therefore, rather you're growing in height, you grow shorter, and then also your spine become a little kyphosis, and then maybe you have some other problems giving rise to scoliosis as well. These factors are brought about by tiny cells called osteoblasts and osteoclasts, which work hand in hand to achieve. One is to achieve peak bone mass at the age of 20-30 plus remodeling of bone, and this process of balancing is accelerated after the age of 30, or after the age of menopause or andropause. So key hormones working on this event is estrogen, testosterone, vitamin D, and parathyroid hormone. So there's like a fine balance between bone and the rest of the body systems. Name it, there's a connection to have some impact over the bone metabolism by each organ. We know kidney, like it has function with the vitamin D metabolism, and it can lead to osteoporosis if you have renal failure. Likewise, all organs, kidneys, thyroid, and then pancreas, liver, intestine, name it, there's a connection which can alter your bone health. And this balance is brought about by fine-tuning of action between osteoclast and osteoblast. Osteoclast will lyse the bone, meanwhile osteoblast will build up the bone. And when you go to the imbalance, when the osteoclast activity predominates, then you get losing your bone mass. This is a comparison of male and female, how much they can achieve in the peak bone mass with age, and then how fast each category will lose. If you look at it, this is a peak bone mass for male, and there's a like decline after age of 30, plus a rapid decline after retirement age. And then female, they have a lesser peak bone mass, and then they have gradual decline after menopause. And there's a very rapid decline, plus a slow decline after the at the retirement age. In addition to this, when we retire, we have high risk of falls, because with aging, it reduce bone strength and muscle strength and balance. And we have sensory impairments, that is, your vision is poor and you are short of hearing, plus your balance is not so good. So there are tendency to fall. And your nervous system will process your data very slowly, the slow speed. So your reflexes are slow then, and you are slow to react to a stimulus. And then your cognition will go down. Also, with the time, you get chronic conditions like diabetes mellitus, arthritis, foot problems, which all together will give you make you a less mobile person and less reactive person. Also, the long-term medications can affect your balance and bone health, something like long-term use of corticosteroids. So these two things add up, osteoporosis plus low energy injuries, which usually should not cause a fracture, but at this stage, it will cause a fracture. Some fractures, for example, in the spine are unnoticeable, but when the long run, when the fractures add up together, they can give rise to like a short stature plus uh, kyphus of the spine. If you look at how bad osteoporosis is as a like epidemiology part, it's a major global health issue at the moment because world is having more elderly people than the younger ones, and the hip fracture percentage is about 20 to 30%, has like a 1 year mortality. If you get fracture cascade, one fragility fracture, for example, hip fracture, doubles the risk of another fracture. So things add on, and the amount of life lost, the quality or by days, is, is quite high when you have this kind of injuries. So to name a few osteoporotic fractures, hip fracture, any hip fracture is usually a osteoporotic fracture, and the Colles fracture, what you know, plus uh, proximal humerus fracture. These all are fractures due to weaker bones. Therefore, let's start investing on bone. That's the whole idea. So if you look at why somebody cannot achieve peak bone mass at the age where it's supposed to be, if you look at the green line, that's the peak bone mass. And the red line is the osteoporotic line where the peak bone mass is not achieved. So when you have a higher bone mass to start, when you start losing, then you you lose slowly. But when you have lesser volume of bone mass to start with, then you lose rapidly. You rise to osteoporotic at an early age than it should be. So this is the area. And then the target is, if you're a young individual, you could start banking to achieve peak bone mass by the age of 20 or 30. These are the things you're going to achieve on a nutritional part. So you need to have a supplement of vitamin D, calcium, and enough protein so that your bone and muscle mass can build up. And then exercise, weight bearing and resistance. That weight bearing is you use your body weight as a resistant to exercise. For example, light hiking, stair climbing kind of activities. And then you can have resistance exercises like where I use a lightweight, like a dumbbell. So muscles work against resistance. And then hormonal health, ensure normal puberty and avoid amenorrhea. And then lifestyle modifications like avoid smoking, alcohol, and undernutrition. Because smoking and alcohol has direct impact on osteoclast and osteoblast activity, giving rise to increased bone resorption. Exposure to sunlight is a one important factor to have normal levels of vitamin D. If you screen the general population in Canada area, we find most of the reports we see, the vitamin D levels are either insufficient or they are insufficient or they are like deficient. And chronic medical illnesses like rheumatoid arthritis or long-term betterment also will lead to osteoporosis long term. And then we need to identify like what factors we can modify to achieve if there is something resisting achieving peak bone mass, we need to identify them. Age, sex, ethnicity, family history, and genetics are non-modifiable risk factors for osteoporosis. And then, of course, there are many modifiable stuff which you can identify and correct so that you can achieve the target uh, peak bone mass by the age of 20 and 30. Right. So if you look at this, to achieve peak bone mass, we have this target for male at about 20, 30 years of age. And then this is the retirement age. So if somebody is not achieving target bone mass, then we need to know, we need to find out why is this. So we have screening tools to detect osteoporosis. X-rays of spine and hips is like kind of a crude method of doing it. If your eyes are like tuned to look at X-rays, seeing the X-ray, you can say, okay, this bone is osteoporotic. But it's very crude and like observer dependent. Then we have something called fracture risk assessment tool. These are online. This is available online. You can log into the site, and it gives you to option of selecting your area or region of the world and then country. And then if you need to enter a few data, which I'll show you in a minute, and it will give you a 10-year risk of probability of you having a fracture. And then we have DEXA scan, where it measures the bone density. It's recommended for women to have it around 50 years of age, and for men about 60 years of age. For Sri Lanka, recommended by Sri Lankan College of Geriatricians. And also other cases like early osteoporosis can set in patients with prolonged mobilization or rheumatoid arthritis. So these people can be screened before they reach the target age. So this is an example of osteoporotic spine. If you look at here, this is kind of normal, and this one is wedge shapes. So when a few wedges are added to the spine, you become kyphus, you become like bending forward, so you can't walk straight. And then the fracture risk assessment tool. So if you go online and log into this site, it gives you this table, a few buttons to click on, and they give you a 10-year risk of you having a fracture. Right. So this is the result, how you read your result. So if you are, say, 65 and your risk is like, say, under 5%, you are kind of okay. But it comes more than either 10 or 15 or 20, you move into your red zone, then you need to have active treatment to treat osteoporosis. Our next test we have is the DEXA scan or dual energy X-ray absorptiometry. It comes a result coming as a T-score, which is 2ST value on either side, and the assesses fracture risk. We have another measure called ISERT score. ISERT score will tell you what is your bone mass in compared to a similar age healthy individual. So normal density of the bone is minus 1ST to plus 2ST. Anything between minus 2ST to minus 1 is called osteopenia. Anything below that is osteoporosis. And osteoporosis is with a fracture, you call it severe osteoporosis. That's how we categorize that. And then we look at what interventions we need to do depending on your T score. Right, so T score, which is normal, so it's only like lifestyle advice, which we just discussed, and supplements. And medical treatment or the chemical treatment is not indicated at this stage. For anyone with osteopenia, then you can have both supplements plus lifestyle modifications. Medical treatment is only when fracture risk is high. And anyone with osteoporosis, both all three components are yes, that is lifestyle modifications, and then food supplements, that is protein, vitamin D, and calcium, plus treatment with bisphosphonates. And severe osteoporosis, that is osteoporosis with a fracture, category of these people might need intensive high like a rapid treatment correction of osteoporosis to prevent another fracture. So these are the age group like where we are lying on. Either we are osteopenic or osteoporotic. Then we look at in detail like what we need to do at this stage. So osteopenia, so lifestyle modification supplements. We need to have regular weight bearing exercises, minimal like every other day. It says about 150 minutes per week. That is about 60 or 1 hour, 3 sessions of 1 hour for each week for you to maintain what you have. And then you should not smoke, no alcohol, reduce caffeine because this caffeine will reduce calcium metabolism or calcium absorption from the gut. And then we go to assess your fracture risk with the fracture tool. And then if risk is high, then we go to start on bisphosphonates. Or in other, say, estrogen modulator receptor blockers, modulators in postmenopausal women. And if there are any other secondary cause, we need to treat that. And then we need to follow up after intervention by DEXA scan every 1 to 2 years to see response. Once you see the response, you're going to recalculate your frax tool and check where you are lying. And depending on the result, you can like come back to the normal cycle and start treatment again. And then the next category is osteoporosis. Then we need to have regular weight bearing exercises, same lifestyle pattern. And first line pharmacotherapy for this group is either oral or IV bisphosphonates. We have, I think, once weekly supply, once monthly preparations, or once a year preparations. It depends on like what you want and how much you can afford. And then HRT on selected postmenopausal women. And then in addition to this, we got to have measures for fall prevention. That is, we need to have balance training, which is part of the exercise regime. Your resistance exercises will improve your balance and muscle strength. And you got to minimize home hazard. That is where you can have a fall in your home, steps or dark areas, maybe any slippery floors. You need to correct once you reach that age because a simple fall can break your hip. And then wear glasses. Or maybe you use a walking aid when you walk, either indoors or outdoors, so that you are protected. And then this category of patients needs to follow up every 1 to 2 years after commencing treatment. And depending on your frax tool risk percentage, if you're on low risk category, that's green, moderate yellow, high risk red, and then very high risk just above that. And then so these patients need follow up or duration treatment for 3 to 5 years, and then you can reassess for a drug holiday. That is, you stop medication for a while and reassess them. And the moderate risk, you need to have a longer period of bisphosphonates and reassess. High risk patients up to 10 years of bisphosphonates. So if you look at the amount of medication you have to take, if you are not prepared by the age of 60 to live rest of your life, see how much of medication you have to take. So if you try and build up your bone mass now, and then the amount of medication you could take will be quite less. And then high risk people, they need like start in addition to the alendronate, they will have like anabolic kind of treatment and very close follow up with regular scans, and then make sure they have adequate amount of bone mass is left. And then we being doctors, like special considerations. If you think about it, we spend most of the time indoors, either theaters or clinics, and chance of exposure to sunlight is quite less. And then so vitamin D deficiency like invariable in most of the health staff, not only doctors, maybe nurses or any staff inside the hospital. And then our meal pattern is quite irregular. We don't eat on time, or we keep fasting and we eat some a very high calorie fast food most of the time, depending on the time we have, and sedentary. We don't move around much. So therefore, chances of osteoporosis is quite high in health staff. And on the other hand, we got to be like role models for other patients. So patients will follow. Like if we follow it and show it to them, okay, this is working, why not you then? So likewise, you got to be a role model. And so our investment is for bond, is for like healthy bonds, targeting independent retirement. That is, you live on yourself without disturbing other people. And then, for example, if you have a fracture at this age, see, it's like a big problem. Like, if you look around social situations, it's problem to your children, and if they go to take you to hospital, and they bring it back, and it's pain for you, and they're losing. They go to apply leave for that. So lots of commitments they have to go through. If you have fracture at the age of say 80, because most of the Sri Lanka setup, most children are not in Sri Lanka, maybe they are living in other countries, they can't come, so various problems. But if you prevent that, if you prevent the fracture, so everyone will be like happy and safe. And then optimize bone health before retirement and prevent fractures after. So that's the whole idea you need to have. And then we have a little like take home message. So it's all about bones. So if you do this, you can optimize your bone mass. So balanced diet, and then get yourself screened, and no smoking, limit alcohol and caffeine, and do exercise, both types, resistance plus balance, and try and see some sunlight, which is difficult, but if you can do it, so that's the whole idea. So thank you for banking with us.